everyone, I'm Anastasia signing in from NORAS. In our previous session, as we have started discussing about the physiology and the factors affecting bowel elimination, in this session, we will be discussing about the alterations in the bowel elimination. As we know that bowel elimination is a natural process by which the solid waste products of digestion, which is the feces or the stool, are eliminated from the bowel. Here, there are certain conditions that can lead to alteration in this process of defecation. Here, these conditions includes the constipation, diarrhea, bowel impaction, bowel incontinence, as well as flatulence. So, constipation is a condition in which a person will be having fewer than 3 times of the process of defecation in a week, which can result in a dry, hard, or even no passage of stool. And diarrhea is a condition in which there will be passage of liquid stools in an increased frequency, which can also be associated with the presence of spasmodic cramps. The third one is the fecal impaction, where in a person will be having a mass or collection of hardened feces in the folds of the rectum. Bowel incontinence refers to the loss of the voluntary ability to control the fecal as well as the gaseous discharge from the anal sphincters. And the last one, which is the flatulence. This is a condition where there will be accumulation of excessive gas in the gastrointestinal tract, which can also lead to abdominal distension. So because of these conditions, it can lead to alteration in bowel elimination. So in this session, we will be discussing in detail about constipation, whereby we will get clear idea of how constipation can alter the bowel elimination pattern. Constipation is a term which is used to describe an infrequent bowel movement or even an irregular act of defecation, whereby there will be an abnormal hardening of the stool, which can lead to difficulty or pain while one is defecating. And because of this, there will also be an decreased volume in the stool or even retention of the stool in the rectum for a prolonged period. So here, as we have discussed, that constipation is a condition in which there will be an infrequent bowel movement, there will be an irregularity in the act of defecation, whereby a person might defecate less than 3 times a week. And this would ultimately result in hardening of the stool, which may cause pain, discomfort, or even difficulty while a person is defecating. And because of this, it can also reduce the volume of the stool, or it can also lead to retention of the stool in the rectum for a prolonged period. So what are the causes of constipation? The first one is the medications. Here, if a person is under certain medications such as the tranquilizer, the anticholinergic, the antidepressives, the antihypertensive drugs, the opioids, or even the irons, then this could lead one to suffer from constipation. The second cause is also idiopathic, whereby we might not be able to find out the cause. Here the cause will be unknown. The third is the rectal or anal disorders. So here, if a person is suffering from any rectal or anal disorders such as hemorrhoids, then this can also lead one to suffer from constipation. Not only that, but if there is presence of obstruction, for example, if a person is having cancer of the bowel, if he or she has just undergone any surgery involving the rectum or the intestine, if he or she is suffering from any neuromuscular, metabolic, as well as neurological conditions such as the Hertzsprung's disease or the diabetes mellitus, if a person has lead poisoning, if a person's dietary pattern is altered, if he or she is having inadequate food, following an irregular diet, or following a diet which does not contain adequate amount of roughage, or even a low residue diet, then this can also lead one to suffer from constipation. Here, if a person is also not having adequate amount of fluid, then it could lead to dehydration, and because of this, it could also lead to lower fluid and electrolyte in the body, which can further lead to hardening of the stool, and because of this, again, one may suffer from constipation. If a person is suffering from any chronic illnesses, or if a woman is pregnant, then this can also lead to this condition again, because here, as we have discussed in the factors affecting that pregnancy, is also one of the factor that can affect the bowel elimination, because here the fetus will be growing and this would exert pressure on the rectum, which would later lead to an obstruction. So because of this, even if a woman is pregnant, then she can also suffer from constipation. If a person is having huge amount or is frequently consuming beverage, if he or she is suffering from any connective tissue disorders, or if he or she is having an irritable bowel syndrome, and then if he or she is weak or is fatigued, if he or she is immobile, which means if he or she cannot move, if he or she is bedridden, or he or she is not performing exercises, then this could also lead to this condition. If a person is not in a correct position while defecating, if he or she is in an unnatural position, then this could also affect the act of defecation, because as we have discussed that squatting is the normal position for defecation. So if he or she is in any other position rather than squatting, then this can also be one of the cause. If a person is emotionally disturbed, that is, if a person is anxious, if a person is stressed, or even if a person is depressed, then this could also cause constipation in a person, because here, if a person is depressed, then he or she will not get the urge of defecation, or even if he or she is having the urge, they will not feel like moving, they will not feel like going and defecating. So because of this, it can also lead one to suffer from constipation. And also, if a person is old, here, as we have also seen in the factors affecting that, age plays a major role. Here, if a person is old, then you will also find that the rate of them suffering from constipation is 5 times more than the young adults because of decreased peristalsis. And the last cause is the environment in which the patient is in. Here, if there is a sudden change in the environment, for example, if a person is admitted to the hospital, then he or she might have to use the public washroom. So because of that, or if a person is bedridden because of his or her disease condition, then he or she might not be able to use the washroom and they would have to do it in the bedpan. So because of this, there will be lack of privacy, there will be presence of discomfort and embarrassment. So here, change in the environment is also one of the factor that could cause one to suffer from constipation. So I hope you've got a clear understanding of each of it and how it can affect. Now let us move on to the clinical manifestation. So here, if a person is having constipation, then it is obvious that he or she will be having an abdominal distension. There will be presence of gurgling, rumbling sound when the gas is passing through the intestine. There will also be presence of pain. He or she will be feeling the presence of pressure. They will also have a sensation of incomplete emptying after they have just defecated, and there will also be presence of straining of the stool during the process of defecation, because here, as we have come to know, that if a person is having constipation, then they will be having a hot and a dry stool. Because of this, they would have to strain themselves while they are defecating. So these are the symptoms that you will be encountering in a patient who is having constipation. So since we have discussed about the causes as well as the signs and symptoms, now let us move on to the management. Here there are two management. The first one is the medical management and the second is the nursing management. Under the medical management, the first thing what we need to do is we must first find out the underlying cause. So here, for example, if a person is having hemorrhoid, then we must first treat the hemorrhoid and then move on with the treatment, because here sometimes the presence of this constipation is because of this cause. So if this cause itself is being eliminated, then constipation will be resolved by itself. Here you must also advise the patient to perform routine exercise in order to strengthen their abdominal muscles. A technique known as biofeedback can also be used in order to help the patient relax their sphincter muscles to expel the stool. We can also add 6 to 12 teaspoons of bran in the diet which a person is following. And in an elderly person, laxative can also be prescribed. So this is what we are going to do in the medical management. However, as nurses, we also have our own responsibilities. So whenever you encounter a patient with constipation, it is our responsibility to find out their history. We must try to elicit the information related to the onset and the duration of constipation. Here we must also find out their previous as well as their current elimination pattern, and we must also collect information related to their lifestyle pattern. For example, their occupation, whether they are performing any exercises or not, their activity level, and also the diet which they are following, whether they are consuming adequate amount of fluid or not, and also the presence of the stress level. Here, as we know that emotional stress, depression can also alter the bowel elimination. So here it is also very important that we get to know whether they are suffering from any emotional instability or not. As we also know that patient education and health promotion is an important function of a nurse. So here, as a nurse, you must always educate the patient. You must educate them about their disease condition. You must educate them regarding the importance of maintaining a regular pattern of elimination. You must ensure that they consume adequate amount of fluid. You must ensure that they also include the fruits in their diet, as well as follow high fiber diet. You must educate them about the importance of performing various exercises, especially the ones which would help to strengthen their abdominal as well as their perineal muscles. You must teach them the relaxation technique. You must provide privacy while they are defecating, either it be at the hospital, or even you must advise the family members to provide privacy to them during the act of defecation, even when they are at home. As a nurse, you must also assess their psychological status. So here, if you find out that they are having depression, they are anxious, they are stressed, then you can also provide the required psychological support. You must also educate them about the importance of the normal posture while they are defecating. Here, as we know that squatting is the normal position that one must take during the act of defecation. So here, as a nurse, it is our responsibility that we advise them to take that position, because this position would help to exert pressure on the abdominal muscles, as well as it would help to contract the thigh muscles. So here, if the constipation is still not relieved after you have advised or after you have made sure that the patient had followed those measures, then laxatives may also be administered, but with caution, because here administration of laxative can lead to a chance of habit formation. So here, if a person complains that he or she is having constipation, as a nurse, you must first advise them to follow those measures. And after they have followed it, if you find out that it still is not helping them, then only you must administer, or you can advise them to take the laxatives. So these are few of the things that you as a nurse must educate them about. So I will be concluding this topic for today, whereby in today's session, we have looked into the conditions that can lead to an alteration in the bowel elimination, and we have discussed in detail about constipation. So I hope you have got a clear idea how this condition can alter the bowel elimination of a person. I'll be meeting you in my next session where we will be discussing about the other conditions such as the diarrhea, the bowel impaction, the bowel incontinence, as well as the flatulence. So until then, have a good day. Thank you.